Well, thank you, Matt, and good morning, everyone, and thank you for joining us here this morning. It's great for myself to be back in Regina here this week. As we know, the Omicron variant continues to spread, not only here in Saskatchewan, but across Canada and in many cases around the world. But we are now in a very different phase in this pandemic for a few reasons. First, lockdown and vaccinations do not seem to be stopping the transmission of Omicron, the Omicron variant, but at the same time, we are seeing Omicron with a much quicker cycle of infection, and it seems to be less severe than previous strains, particularly if you are vaccinated and have your booster shot. And that's why we are now seeing in some countries, as well as some provinces across Canada, starting to discuss the removal of their remaining measures that they have in place, their public health measures. They're also starting to talk about how they're going to live with COVID as we move forward through the next number of weeks and months and ultimately into eternity, and how we are going to get our life back to a much more normal semblance of normal. We're not quite at that point yet here in Saskatchewan today, but we could be in the near future. Our hospitalizations Our hospitalization admissions are rising, yes, but they remain lower than other provinces that have imposed a much stricter form of lockdown policies. And Saskatchewan's rate of fatalities from COVID remains to be one of the lowest in Canada. Today we have 262 patients that are in hospital with COVID. 26 of those are in ICU. Not all of these patients were admitted due to COVID. 113 of them were. 107 of those cases are incidental cases. Patients who were incidental cases are patients who were admitted for a different reason and then ultimately tested positive with COVID on their admission. But even if we look at the larger, more holistic number, Saskatchewan's current rate of hospitalizations and ICU admissions is below the national rate, as well, and it's well below a number of provinces that have imposed much more stringent public health measures and much more stringent lockdowns than we have here in Saskatchewan. For instance, in the case of Quebec, the province that has likely the largest or most extreme lockdown policies in place in Canada, they currently have just under 40 hospitalization admissions per 100,000 people. That's nearly double the rate that we have here in Saskatchewan. Saskatchewan continues to have the lowest rate of COVID-related fatalities of any province throughout the month of January. Again, if we look to Quebec, the area of Canada that has the most stringent lockdown policies in place, they have over 1,000 COVID fatalities in January. That's about 7 times more than we have in Saskatchewan on a per capita basis, 7 times more. Omicron is spreading across Canada and spreading around the world regardless of the public health measures that are in place, which is why we have chosen to avoid increasing those public health measures and increasing the policies surrounding lockdowns here in Saskatchewan. We are not going to impose additional restrictions that cause significant harm for no significant benefit. I've also been challenged by some to provide evidence that lockdowns don't work. The evidence is right here in Saskatchewan as we manage through this Omicron wave with very little in the way of restrictions on people's lives. And we have lower rates of hospitalizations, lower rates of ICU admissions, and lower rates, thankfully, of fatalities through the month of January than many other provinces with much more severe restrictions. And we're avoiding the economic and psychological harm and the infringement on personal freedoms that are often caused by lockdowns. Listen, COVID is not going away. It's going to remain an ongoing concern for all of us. But we live with other diseases in our communities and in our province that are also ongoing concerns. We do this without locking down, without taking away people's freedoms, and without disrupting everyone's life. We need to make every effort to get to that point with COVID-19. It's encouraging to see other countries beginning to have that discussion as they begin to emerge from this Omicron wave. Now, there are things that we can all do and things I would put forward that we should do, and things that in many cases the vast majority of Saskatchewan people are already doing to protect ourselves and to reduce transmission, and to help us continue to reduce the pressure on our hospitals. Most importantly, go out and get vaccinated. And then go out and get your booster shot. Being vaccinated does not help you from contracting COVID, but it should keep you from becoming seriously ill. That was certainly my my personal experience. I really had a little, if any, symptoms at all, and felt quite good throughout my COVID infection. And I expect it might have been a lot worse had I not been fully vaccinated and I had not had my booster shot a couple of weeks prior. So we're fortunate in Saskatchewan where we have access to vaccines and we also have access to our booster shots and have for some period of time. So I would encourage everyone to go out and avail themselves to those yet again. As I said, Saskatchewan not only has booster shots available, but we are one of the leaders in the country in delivering those booster shots. About 46% of those that are eligible residents over the age of 18 have now gotten their booster in this province. Most importantly, and more importantly even than that, about 74% of everyone over the age of 60 has gotten their booster shot in Saskatchewan. As we know, all too well in this province and across Canada, that elderly people are more likely to have serious outcomes when it comes to a COVID infection. So that high booster rate among our elderly residents is a tremendous layer of protection that is keeping a lot of people from becoming seriously ill and ultimately and possibly being hospitalized if they do contract COVID. The other important area where we are leading the country is in the distribution and the actual use of rapid tests, and I've seen this firsthand in the communities that I visited over the month of January. I saw this in my own case. Since I had no symptoms, I would never have known that I had COVID if I was not doing a rapid test on a regular basis. Rapid tests are widely available across this province. We'd asked everyone to have one in their place in their home. So pick them up and have them at home for when you need them. Rapid tests and booster shots are the two most important things that we can do right now in our battle against Omicron, and they certainly were helpful in my personal case. I only found out that I had COVID when I did a rapid test. And I had just gotten my booster a few weeks before. And as I said, I had hardly any symptoms, if any symptoms. And I also would say I understand that this is not going to be the case for everyone. And this is why we need to be vigilant and diligent in our efforts so that we can find our way through this Omicron wave without having a severe impact on our hospitals. We're going to continue to promote and deliver preventative measures that are effective in this province, effective at identifying the spread of COVID, and effective at preventing severe illness due to COVID. Tools like rapid tests and booster shots. So once again, I would just say thank you to everyone in Saskatchewan for everything you are doing to keep yourselves safe, to keep those around you safe, and ultimately to ensure that we're going to find our way through this Omicron wave.